Good morning, good afternoon, good evening. My name is Justin Scarr. I'm the Chief Executive Officer of Royal Lifesaving Society, and I have a number of roles with the International Lifesaving Federation. Welcome to the WHO World Drowning Prevention Day webinar. I'm coming to you from Whadjuk land. Whadjuk is part of the Noongar Nation in Western Australia, Perth, and I pay my respects to their elders past, present and emerging, and acknowledge their ongoing custodianship of the land and the water in this area. This webinar is a very special day for all of us. We've enjoyed a number of days and weeks in planning World Drowning Prevention Day. We've been watching local communities and also national activities and global events with eagerness. So today what we're doing is celebrating those activities, your achievements, the many achievements that have been had in recent days. We've got a number of panelists. We've got a really exciting program, but what I'd like to do is just encourage you to do a couple of things. Use the chat early to introduce yourself, say who you are and where you're from. And then as we go, use the chat to pose questions. And then finally, my challenge to you is to use the chat. At the end of our webinar, we will be choosing around 20 people to come into the webinar and make some statements or some questions, perhaps just talk about the one thing that they did. You will be time limited. It will be only 30 seconds and you'll be shut off if you go beyond that 30 seconds. But if you'd like to make a comment, just list that in the chat. And also, if you're a participant and you see someone make a good comment in that chat, give them a tick, a like, whatever emoji you prefer to use, and we'll be monitoring those people and bringing them in as we progress. It is a celebration. We've achieved a lot in the last week, so please relax and enjoy the wonderful webinar that will unfold. So many great speakers. Probably in many respects, the most important one I'd like to introduce now is Dr. David Meddings of the World Health Organization. David is a great friend to drowning prevention. He's been a significant leader in this field, contributed to coordinating the global report on drowning, various guidelines that have helped the field, and he's been instrumental in the UN resolution as well. So I'd like to invite David to say a few words. Welcome, David.
Well, thanks, Justin, and hi, everyone. It's wonderful to see so many of you on this webinar. I'm not going to be particularly formal in my remarks. As Justin has said, this is really a celebration today. And the only point I want to make here is that we have a lot to celebrate. This is our second ever World Drowning Prevention Day, and I think all of you on the webinar today will be convinced that we have made tremendous progress on drowning over the last year. And importantly, this progress has been across the board. It's taken place at the grassroots levels, in villages and community settings, around the ponds, the beaches, the rivers, and the coasts where drowning takes place. It's taken place in the meeting rooms and planning spaces where many of you engaged in drowning prevention organizations have shaped the drowning prevention planning and commitment of your organizations. It's taken place in governments across very often a wide range of sectors and ministries, and that's led to important national policy and programming progress to address the main risk factors for drowning and target the most vulnerable with evidence-based planning. And finally, it's taken place within and across the UN system. My guess or my hope is that many of you are already keenly aware of WHO efforts on drowning prevention. And just to give you a very quick word about where we are at, currently, we are intently focused now on ensuring that drowning prevention activities are implemented safely and effectively in line with WHO practical guidance. But more importantly, in my view, today you are going to see and hear from important complementary efforts of a host of other UN agencies as part of the mandate given WHO and the UN resolution to coordinate activities within the UN system. WHO is looking forward to developing a higher level of collaboration with our UN partners around drowning in the future. So your collective commitment to drowning prevention over the last year has shown that many of you have not only done one thing to prevent drowning, you've done many things to prevent drowning. And thanks to your combined efforts, we definitely have a lot to celebrate today. So let me end by saying that on a personal level, this commitment and engagement, it's a source of deep personal inspiration to me, and it truly keeps me energized and enthused about the work I'm doing. So thank you all of you. And I'm going to hand back to Justin now to lead us through the rest of the webinar.
Thanks very much, David, for your inspirational words and ongoing support and mentorship to so many across the field. I do think WHO has been embracing of so many different groups in recent years, and I think it's a testament that we have over 500 people joining the webinar this evening. But let's get moving. We did have problems with the chat, and thank you to various people, Ross and David Walker, letting us know, but it's been fixed now, we believe. So hopefully introduce yourselves and also log your questions and comments as we progress through your morning and my evening. All right, let's get started. The first section is actually reflecting on the success and planning for the future. We've got some great high-level reflections on global drowning prevention, where it's at, and where it's headed. And so I'd like to introduce the first video presentation from Dr. Tedros, the Director General of the World Health Organization.
Esteemed guests, dear colleagues and friends, drowning claims hundreds of thousands of lives every year and is one of the leading causes of death for children and young people worldwide. 90% of these deaths occur in low and middle-income countries. They are linked to routine activities like bathing, water collection, fishing, and traveling in boats or ferries. There are many proven low-cost solutions to prevent drowning, such as barriers to water, teaching swimming and safety skills, flood risk management, and rescue and resuscitation training. The UN General Assembly's recent resolution on drowning prevention urges countries to implement these and other measures. WHO is working with UNICEF, the International Maritime Organization, and the UN Food and Agriculture Organization to support drowning prevention programs globally. I'm heartened to see that cities around the world are lighting up their monuments in blue as a call to action for each of us to do our part to prevent drowning. Anyone can drown, but no one should. I thank you.
Thank you, Dr. Tedros, for your leadership. And we should also acknowledge Dr. Etienne Krug from WHO, who's also been a really great supporter of global drowning prevention. Our next video presentation comes from Mr. Michael Bloomberg, the former mayor of New York City and founder of Bloomberg Philanthropies.
Drowning is a global public health challenge, and at Bloomberg Philanthropies, we're focused on implementing solutions to prevent it. Today, we're joining our partners around the world in recognizing World Drowning Prevention Day and taking action. The overwhelming majority of drowning deaths occur in low and middle income countries. Children under 5 are most at risk, and in many cases, we know what works to save lives. Bloomberg Philanthropies has long worked in Bangladesh, Vietnam, and Uganda to understand major causes of drowning and address them. That includes supporting community child care supervision, teaching survival swim lessons and water skills, and strengthening data collection. We've also worked closely with the World Health Organization to spur action around the world. We supported their publication of the first ever global report on drowning, and we've developed tools and guidance to help governments implement solutions. These resources are designed to help more countries heed the UN resolution, urging them to take action to prevent drowning. We know what works, and if we do more together, we really can save a lot of lives.
And we thank Bloomberg Philanthropies and Michael Bloomberg for his many fantastic investments across the field. Thank you. Our next video presentation comes from Dr. Louay Pearson. Dr. Pearson is the Associate Director for Health and the Chief of Maternal, Newborn, Child and Adolescent Health at UNICEF.
UNICEF statement on World Drowning Prevention Day. At UNICEF, we know that action on drowning prevention requires focused attention in communities at greatest risk, where children are exposed to open water and increased flooding. Drowning is one of the leading causes of death for children and adolescents globally, killing 96,000 young people under 19 every year. That is more than 10 children every hour. With greater than 90% of child drowning occur in low and middle income countries. This is unacceptable and preventable. UNICEF is stepping up our commitment to act. This includes raising awareness of the magnitude and impact of drowning on children and adolescents, building networks and the capacity of drowning prevention partners in countries to implement proven solutions, advocating drowning prevention to support effective supervision of young people, children, through child care and early childhood education services, and training for adolescents and youth in life-saving skills, including safe rescue and resuscitation of children. Let's work together and strengthen our efforts for drowning prevention. Thank you very much.
Thank you, Dr. Pearson. Great to see UNICEF involved, and I look forward to unlocking their power to catalyse local and national action for children and adolescents. That takes us to our second panel discussion, actually our first panel discussion. It's great to see in the chat there are so many new and old friends, many familiar faces, so keep that going. But remember to also, if you have a question, ask a question via the chat, please. Our second section is titled Working Across the UN to End Drowning. A great introduction from all of our high-level panelists, but particularly Dr. Pearson about the role of the UN. Let us just go into this session, but what I'd like you to do is challenge yourselves, contemplate our three speakers. They come from the International Maritime Organization, the Food and Agriculture Organization of the United Nations, and UNICEF itself. Contemplate what they're doing currently to prevent drowning, contemplate where drowning fits within their agendas, their plans, their activities, and let's have a discussion about how we can build on those strengths and how we can increase their activities in the area of drowning prevention, and then contemplate what role we can play in supporting them and their activities. So let's move to the first speaker. This is Dr. Bakia Sitki Oskoglu. Dr. Oskoglu is the head of the Asia Pacific section and subdivision for the Program Management Coordination for the Technical Cooperation Division of the International Maritime Organization, the IMO. Setki, as we'll call him, has more than 30 years experience in the maritime industry, academia, and regulatory organizations, national and international alike, primarily focusing on a wide range of aspects of maritime safety, including operational, regulatory, and policy environments. So welcome, Setki.
Thank you, moderator. Good day, everyone. Greetings from London. I don't know whether you can see my slides. Okay, now it's coming up. Greetings from London. I want to begin with expressing IMO's gratitude to WHO for this webinar. Dear participants, I regret to admit and begin with highlighting the fact that despite the efforts, passenger ship casualties worldwide occur during domestic ship operations in the developing world, resulting many fatalities in fishing industry is also another high-risk sector for the employees. IMO's regulatory framework applies to ships on international voyages, and the organization's scope of work includes safety and security of shipping and prevention of marine and atmospheric pollution by ship. However, the organization has also focused on safety of fishing vessels and put efforts to improve domestic ferry safety as well. To achieve its objectives, IMO developed and adopted more than 50 treaty instruments, guidelines, and codes to regulate shipping and fishing vessels. These instruments widely ratified across the world However, due to peculiar challenges relating to fishing vessels and domestic passenger ships, these two categories are still less than satisfactory regarding safe operations. Although the list of the IMO conventions related to drowning prevention that you see on this slide is not comprehensive, generally speaking, these instruments can be considered among those related to drowning prevention. These conventions are SOLAS, which is regulating cargo ships of certain size and all passenger ships on international voyages, Cape Town Agreement, regulating fishing vessels of 24 meters and above and equivalent tonnage, STCW and STCWF conventions, respectively, regulating seafarers and fishing vessels personnel on training, certification, and watchkeeping standards, load line and tonnage measurements conventions, regulating structural safety and tonnage measurements of ships, and search and rescue convention. To complement the IMO's regulatory work, the organization also helps its member states with their capacity building efforts to support them in ratification and the implementation of IMO conventions. The capacity building support could be in various forms, such as conferences, workshops, and seminars, or specific short to long-term projects alike. Most recently, to give you a specific example, IMO's Maritime Safety Committee approved model regulations on domestic ferry safety to support the efforts of the member states. And finally, all these initiatives have been spurred by the intent to lessen the occurrence and magnitude of accidents and fatalities at sea and control manageable risks. I would be happy to answer questions during the interactive session, Mr. Moderator. Thank you.
Thank you, Sedki. Our next UN speaker is Ms. Florence Poulain. Ms. Poulain is a fishery officer for fishing safety at the Food and Agricultural Organization of the United Nations, FAO. Florence is a social scientist with 20 years experience in fisheries. Her work has focused on a wide range of aspects of fisheries from regional fishery bodies. Welcome, Florence.
Thank you, Justin, and thank you for inviting FAO to this very important celebration. As you say, FAO stands for the Food and Agriculture Organization, but one of our mandates is to keep fisheries sustainable and safe, and this is why we have been invited to speak today. Next slide, please. So, as many of you know, commercial fishing is a high-risk occupation. It is, we estimate that 32,000 fishers die each year from fishing, but this is an estimation. Where we have data, we know that fatality rates in fishing exceed national average. The most common cause of death is drowning, and most victims are small-scale fishers. Next, please. So drowning is most likely to occur when the fisherman becomes separate from his boat. And that happens when fishers fall overboard at night and get tangled in fishing gear or the vessel sinks. So there are simple things one can do to prevent drowning and accidents. So next slide. And I'll give a few examples. So check your vessel, the weather and the sea conditions before taking the sea. Inform others where you go, with whom, and when you return. Take safety equipment, and here I really want to emphasize the importance of wearing a life jacket. Have the correct communication equipment and make sure the communication equipment is working before leaving. Take spare parts and tools in case of emergency repairs, in case emergencies are needed, and know where your fellow fishers are. So there are also simple don'ts which one needs to be aware of. Next slide. And these are some examples. Don't overload your vessel. Don't go fishing when you are tired, when you're under the influence of alcohol or drugs. Don't go to sea unprepared, and don't go to sea if you are not trained for your job. And so this is important. Accidents, fatalities, drowning are not only technical issues, they're also the outcome of human error. And so you need to be prepared. Accidents happen because fishermen might not be prepared. So you need to be prepared for emergencies and respect rules of navigation. Next slide. So when the vessel capsizes, the fisher should stay with the boat until rescue. So the vessel is your most important flotation device. Do not try to swim to shore unless you are a very confident swimmer. So these are some of the tips to help prevent drowning. So the next slide, and this is how I will conclude. Next slide, please. Yeah. So this year is the International Year of Artisanal Fisheries in Aquaculture. We are celebrating small-scale fisheries all over the world. And if you want more specific information on what FAO does on safety, please go to our website. Thanks a lot.
Thank you very much, Florence. Our third UN speaker is Dr. Raul Bermelio. Dr. Raul Bermelio is a medical doctor with extensive experience on health policy and financing and health systems research and programming for maternal and child health. Raul, as we'll call him, is a member of the Child and Community Health Team at the UNICEF New York headquarters, where he leads a new program areas including childhood NCDs, child injury prevention, and disability inclusion. Welcome.
Thank you, Justin. I hope you can hear me well. And thank you also to WHO colleagues for leading the organization of this World Drowning Prevention Day celebration, really marking an important milestone in the global advocacy for drowning prevention. Next slide, please. At UNICEF, we have included drowning prevention in UNICEF's new strategic plan within our work on child and adolescent health and well-being. This is also a crucial milestone for us, given that it allows the wheels of the organization at all levels to turn and support the global agenda on drowning prevention. Next slide, please. And as Dr. Louis Pearson said in his opening remarks, it is important for UNICEF, given that, as many of you know, drowning is one of the leading causes of death in children. As much as 260 children drown every day. That's one too many. And many of these, 90%, occur in low and middle income countries. Next slide, please. So we at UNICEF are focusing our role and our voice really to raise awareness of the magnitude and the impact of drowning on children and adolescents, being the world's foremost advocate for children's rights. But we are also working hard on building networks and building the capacity on drowning prevention among our partners, working multi-sectorally at a country and regional level. Next slide, please. So we are also working with governments to mainstream policies to support drowning prevention, and these include work in areas as childcare and early childhood services, and training for adolescents and youth in life-saving skills. These interventions, as we know, are evidence-based and important in saving lives and saving lives. Next slide. So we are committed to, across the agency at all levels, committed to work with governments, to support implementation of good practices on drowning prevention. We are working in schools to promote drowning prevention education with students, parents, caregivers, and in communities. We are working with partners, and in particular with the Royal National Lifeboat Institute, RNLI, in really advocating for drowning prevention globally. So we also look forward to working with more partners, including WHO, and deepening our partnership towards this important development area. Thank you.
Thank you, Raul. Now we'll have our panelists join us for a discussion. I should note that I think we have the deputy head of the Bangladesh UN mission, who's said welcome to everyone and acknowledged the UN resolution and the work in Bangladesh. So welcome, thank you for joining us this evening. I'm tracking the chat to see who's there, and there are many wonderful people making all sorts of comments. I'll try and track your questions in those comments. So the panelists, we have Raul, we have Florence. Do we have Setki? Setki is here as well. So let's have a discussion starting at the highest level and just talk about what role the UN agencies play in terms of the high-level architecture and the sorts of things you can do to signal agendas that then flow down into national and local activities. So I might start with you, Setki, if that's all right.
Thank you, Justin. As I highlighted during my presentation, we have a particular program, what we called an Integrated Technical Cooperation Program, and we also have a department recently created to support the IMO's capacity building efforts to work together with the Technical Cooperation Division to focus on more long-term, medium to long-term projects. So we have various projects and willing to do more depending on the resources available. The challenge is particularly in the area of domestic passenger ship operations, as well as, of course, the fishing boats due to the risks. So our capacity building efforts more focus in these two areas. Because the primary problem with the fishing boats operations and the supervisory role and regulatory and enforcement role of the governments is that there's no additional control measures, what we call port state control in the maritime international shipping. Those ships that are on international voyages are also controlled by the ports authorities when they visit foreign ports, which is not applied to passenger ships on domestic voyages and mostly to the fishing boats. And that is the reason why all governments in the developing countries struggle in general, usually with various additional pressure regarding their safeguard or supervisory regulatory role and enforcement of regulations, on these two groups in particular, and that's why our capacity building efforts more focus on in these two categories.
Right. So the setting of standards and capacity building. I actually think that there are many people on the webinar this evening that totally get your language of safety standards and search and rescue. The drowning prevention community is a very broad map, and it includes a number of people that really specialize in safety standards in rescue, and there's quite a significant intersection with some other organizations in the field that probably connect with you on a regular basis. I'd like to take the topic to Florence, if I could, Florence. So if Setki and IMO focuses on standards and capacity building, the work of FAO in your area, in artisanal fishing specifically, what's the role that you play at a national level, and how does that translate, globally, and how does that translate into nations? Okay,
thank you, Justin. FAO's concern is with sustainable fisheries when it comes to fisheries, and sustainable fisheries include safety. People should not, fishers should not die when fishing. Over 90% of fishers are small-scale fishers. They operate in small-scale vessels, and which are simple vessels with simple or no navigation, communication, or safety equipment. So these vessels and these fishers are at risk. FAO is also concerned that looking at what are the root causes of risks, fatalities, and accidents. And one of them, which we are in particular concerned with, is the relationship between fisheries management and fatalities and accidents in small-scale fisheries. So management rules and regulation can make fisheries dangerous. if you set short fishing seasons, you push fishers to fish harder and longer. So you have to be careful, we have to be careful and work closely with governments to make sure our management rules do not create additional risk, do not create perverse incentives. Another reasons why fishers would take risk is economic pressure. Fishers take risk because they need to pay for their children's school fees, for their medicine. And so FAO works on these aspects. So we, one aspect of our work is to work closely with governments on the enforcement and compliance of safety regulations and rules, which is IMO's mandate. But also very importantly, we work on awareness raising, on capacity building, and on fisheries management. So this is what I wanted to emphasize today. Over to you.
Fascinating insights, Florence. The notion of unintended consequences by setting, clumsy sort of standards at a high level, but not considering the implications of local risk and local context, and also the notion that FAO is focusing on poverty and economic circumstances as one of the factors in risk taking is fascinating. I think there are many people that will be nodding their heads and hearing and seeing some parallels within a drowning prevention context. Certainly in a high income setting, fishing for us means rock fishers and recreational fishing off boats, but there are many people that are working in places across Vietnam and Bangladesh and Africa that are nodding their heads at the moment, listening to you, understanding exactly what you're saying. Let's go to you, Raoul. So we've got a notion of standards and capacity building. We've got a notion of focusing on some of the upstream determinants of risk-taking and what's going on at a local community level. The focus of UNICEF, how do you manage the global setting down into the local capacity building that UNICEF is so very well known for?
Yeah, thank you, Justin, and thank you, colleagues. So the way we contribute to the global and national agenda setting around drowning prevention really draws from our mandate that we draw from the Convention on the Rights of the Child. We are the world's foremost advocate of children's rights, and by framing drowning as a child rights issue, I think helps advance this field. It is how we are doing it. It is how we are framing our work on drowning prevention. We work in countries across multiple sectors advancing children's rights. In education, we have adolescent programming, we work to child protection, we have parenting programs that goes right into communities. And it is these programs that we are leveraging to then also include drowning prevention as a component of our programming. And that has been working in communities, and that's how we advance drowning prevention.
Yeah, so it's there's a very strong theme of multisectoral action in the UNICEF program, whether that's a vertical program in drowning prevention or working across a particular community, working on a range of child and adolescent health factors. There was some research from one of our colleagues, Amy Pearden, just recently that really drilled in or honed in on the notion of the burden of drowning in adolescent populations and the almost absence of action in this area.
So just to add, so one thing that we're promoting, for example, is the safe journeys to school, and that is for both road safety and drowning an important framing as well. So for some children, their journey to school is through water. I come from a country, the Philippines, that has a lot of water around it. I've seen children go to school every day on boats. I've been to the Mekong Delta as well and see the exact same thing, children riding boats, going to school. And I thinking about how do we promote safety in going to school for some of these world's children that is through water, I think is an important work that UNICEF is working on.
Yeah, good point. One final question for each of you, and I think this has come up in the chat a few times. I just say to my colleagues, if we mention something interesting and you've got some research or perhaps a brochure, you can also use the chat to drop links to that people might want to have a look at. So the question that came up was, so we've got some really good examples of how UNICEF works. We've got a good example also of how IMO works. and FAO. And we've got some really great examples of WHO in drowning prevention. The question in the chat from Dr. Colleen Saunders, who we'll talk with a little bit later, was how do you work together for drowning prevention? What is that going to look like in a number of years? And are there other examples in other fields where it's quite common for IMO to collaborate with UNICEF and FAO or other UN agencies? So the question is really about cross-UN collaboration for the purpose of a particular issue. And, you know, where are the examples for us and what might it look like in the future? Anyone? Let's start with you, Sepki. You look like you want to say something.
If I could jump in, Justin, we have been working very closely with FAO and ILO, in fact, in the area of safety of fishing boats for a long time. And it is not just a collaboration for capacity building, but it is a collaboration in the area of regulatory framework. So we couldn't, of course, go into details because of the time restrictions, but yes, we have been working with these sister organizations in the area of regulatory framework. And as David highlighted, and the Director General has also highlighted earlier, now this is another example of UN agencies working together. So we will certainly continue doing that. And thank you for reminding us. I will now share a very recent good example of our capacity building efforts, which is directly linked to drowning prevention, and I will share the link in the chat. Thank you.
Thank you, Sepki. Florence, you got some views on how the agencies work together in areas and what that might look like in the future for drowning prevention?
Yeah, thanks very much. Yes, as Sepki was saying, our historical partners in this area are IMO and ILO and International Labour Organization. As I said, you know, having the right rules and regulations in place are important, are a key aspect of this work, but also enforcement and compliance and having the resources for this. And what I would like to highlight particularly is the importance for us. Safety is also a behavioral issue. It's a social issue, and this is what I think is our value added to this work with IMO and ILO. And I'm happy about this event and WHO inviting us, because I hope it will be the beginning of a new partnership.
Fantastic point well made, Florence. So the drowning prevention community is multidisciplinary, but I do think there's room for more social researchers and social action. So Raul, just some final quick comments, if you don't mind, on this question of UN agencies collaborating.
We have contributed to WHO's normative guidance development work in this area, but for the future, I think I would like to see kind of a more formalized coordination platform in this space of drowning prevention, in the same way we see, you know, the UN Interagency Task Force on NCDs, for example, or the Road Safety Coalition that allows for really a more systematic cross-linking of our work across UN agencies. So something like that would be very welcome.
Fantastic. So a joined up agenda. Great point. Thank you very much. I'd like to thank Raul and Sepki and Florence for a wonderful UN, just a taste actually. We could spend an hour, possibly hours, and in the future we'd like to see you at our World Conference on Drowning Prevention at some point, and we'll continue the conversation in many ways. So thank you to each of you. We're going to move to our next panel. But that was really, really fascinating and some really great chat and interaction. So thank you. Keep that going. So next, oops, here we go. So the next is actually some people that are familiar to many of us. So we've heard from UN agencies, and now we're going to talk about the momentum that's been generated over the last 16 months since the UN resolution on global drowning prevention. We have a panel that includes Dr. Carolyn Lukaczyk from WHO, Dr. Colleen Saunders from the University of Cape Town, and Dr. Olive Kubasengi from Makerere University in Uganda. We're going to start with Dr. Lukaczyk. We're going to spend a little bit of time talking about momentum. So over to you, Caroline.
Thank you so much, Justin, and good morning, good afternoon, and good evening all. It's my pleasure to be with you here today on this exciting second World Drowning Prevention Day celebration. So for today's webinar, I've been given a very important task. I'll be sharing the top 5 milestones to celebrate in drowning prevention from this past year. And now, before I get started, I'd like to provide 2 very, very important comments. Firstly, although we've had to limit this session to only 5 milestones due to time constraints, we'd like to acknowledge the huge number of achievements in drowning prevention that have occurred globally in this past year. We've had a glimpse into these achievements through the many excellent videos submitted by all of you for this webinar, and we hope to keep receiving updates from you at WHO about the excellent work you're doing. Reviewing these video submissions, I have to say, has actually been a highlight of my year so far. It was very inspiring. Secondly, although I'm providing a very high-level overview of 5 huge moments, I'd like to acknowledge the hundreds, if not thousands, of people who really worked tirelessly over past years and decades to make these milestones happen. It really is my privilege today to provide this very humble overview. So without further ado, will you please change the slide to the first milestone? Next slide, please. Excellent. So milestone 1, the government of Bangladesh has committed $32 million towards preventing drowning among children, and this was sponsored by the Ministry of Women and Children Affairs. This funding will be used to implement a childcare development and safety project that started in January this year and will run through until December 2024. I'd like to highlight here the scale of investment from the government of Bangladesh, which has resulted from over 20 years of work on the issue of drowning prevention. This demonstrates the continuation of Bangladesh as a true global pathfinder for the agenda. Next milestone, please. Milestone number 2. The Vietnamese Prime Minister passed a 10-year national program on child injury prevention, which includes many specific drowning prevention targets. One of these targets aims for 50% of children aged 6 to 15 years to be able to swim by 2025 and 60% to be able to swim by 2030. Very importantly, this plan showcases the Ministry of Labour, Invalids and Social Affairs, or Melissa for short, as a lead agency for all cross-cutting child injury prevention issues. And through this role, Melissa has engaged 9 other ministries in drowning prevention in Vietnam, enabling the adoption of national drowning prevention work by the government itself and decreasing reliance on international donors for this. Next milestone, please. Milestone 3. The World Health Organization produced new guidance to support partners implement targeted evidence-based drowning prevention strategies. So I'm really pleased to speak to 3 new publications in particular. These include the first ever regional status reports on drowning prevention developed for the Southeast Asian and Western Pacific regions, which together account for 61% of global drowning deaths. These reports provide an overview of existing policies, strategies, data, programs available by country relevant to drowning prevention and water safety, and we hope they'll inform targeted drowning prevention efforts at the country and regional levels. More recently, we've also published practical guidance, which provides best practice recommendations for 3 interventions to prevent drowning. So provision of daycare, basic swimming and water safety skills, and safe rescue and resuscitation training. This guidance can be used to ensure safe and effective program implementation in community settings. These are available for free on the WHO website, and we warmly welcome you to download and look through these publications. Milestone number 4, please. Milestone number 4 is the emergence of high-quality epidemiological data on drowning and associated risk factors for East African countries. The results from significant research led from the CDC Foundation, Makerere University, Kwame Nkrumah University of Science and Technology, and Bloomberg Philanthropies. This has led to the creation of a national water safety plan for Uganda, together with commitment for follow-up drowning prevention work. Further to this, a similar large-scale data collection effort is currently underway in 52 districts in Ghana. This will provide additional detailed information on the circumstances of drowning and will enable more accurate national estimates for burden of drowning in Ghana. Milestone number 5, please. Milestone number 5 is drowning prevention research has gained investment and exposure. Now, there are a number of examples that contributed to this milestone from across the world, linked to an unprecedented growth in the number and amount of funding opportunities for drowning prevention research. This momentum has spurred additional research funding being allocated to the field to further strengthen the evidence base for action on drowning prevention. One specific notable milestone is the publication of not one, but 2 peer-reviewed articles focused specifically on drowning in the Lancet, which is a world-renowned leading medical journal. So with that, these are 5 very important milestones my absolute pleasure to share with you today, and I'm sure they'll provoke a very interesting panel discussion to follow. So thank you very much, Justin. Back over to you.
Thanks, Carolyn. I was so excited to hear your big 5 that I forgot to introduce you properly. So, of course, Caroline is working in Geneva now, which was I thought that would be the most exciting thing that happened in your world in the last 12 months, other than, of course, your Kelpie arriving in Geneva, and we shared some lovely photos of that. But let's be serious. We're having a discussion. Let's get our next panelist. Our second panelist is Dr. Colleen Saunders. Dr. Saunders is a senior lecturer in emergency medicine and injury epidemiology at the University of Cape Town in South Africa. She also convenes the Scientific Advisory Committee of Life-Saving South Africa. And she was the convener of the World Conference on Drowning Prevention. The last time we all met face-to-face, I think, in 2019 in Durban, South Africa. Welcome, Colleen. And we'll have our next panelist, our third and final panelist for this section, Dr. Olive Kobusenge. Olive is a surgeon and injury epidemiologist. She's a senior research fellow at the Makerere University School of Public Health. She's a distinguished fellow with the George Institute for Global Health. When she's not writing books and on global webinar tours, she's doing many, many things to help Ugandan injury prevention. So welcome, Olive. Okay, so, I think actually Carolyn's gone in big. We were going to talk about the 5 big things that happen across drowning prevention, momentum, and she's kind of pulled out the big guns. And they're big, big, big things. But let's start with you, Colleen. Can you just talk about some of the big things that have happened from your perspective, particularly from a research perspective?
Sure, I think Carolyn stole some of my thunder already, but I think definitely I'd like to reiterate milestone 5 there. I think we're seeing much more kind of recognition in the academic sector of drowning as this multi-sectoral issue, and we're seeing it in very high-profile publications as well. So both of those that Caroline, those commentary pieces that Caroline highlighted, but there's a few others that are working in the space as well. Jagnor, Rebecca Sindel and colleagues that wrote the State of the Art Review on climate change. I think it's been in the chat a little bit as well. And I think those are quite key publications that have come about since the UN resolution, just positioning drowning outside of the traditional kind of injury prevention sector, and into this global health, public health space. I also think, as Caroline said, there's been, since the resolution, I think there's been 2 big funding calls that have specifically highlighted drowning prevention in their calls. So the NIHR Right 4 grant last year specifically had wording around addressing the issue of drowning, and that was specifically for implementation research as well, which is exciting. And the NIH, I think, recently issued a notice of special interest on drowning, also implementation research. So I think for me, those are 2 quite key accomplishments that we're starting to be recognized by these big players in the academic space. And another heartening issue, sort of emerging research space as well, is that there's a lot more research coming out of the low middle income kind of space, and particularly in Africa. There have been a number of publications since the resolution, and bearing in mind that the research life cycle is quite long, so most of these had probably started long before the resolution was in place. But there has been quite a lot of research coming out of Africa, and what I really like about the drowning prevention community, I think Justin speaks quite nicely about the friends of drowning prevention worldwide, is that it is a very collaborative community. So there isn't, in other research sectors, there's often a case of kind of fly in, fly out research, and nobody includes local collaborators. But a lot of the work that's coming out of Africa is very collaborative, with local capacity building and more coming alongside as support rather than taking over. So those are 3 key things, I think, for me in the research space. We've seen an explosion of drowning, I say explosion, but a big increase in drowning publications over the last few years. As I say, most of those are kind of coming along with the resolution and not necessarily as a result, but certainly momentum building.
Fantastic. We should take credit for all of that. I think the resolution and the global report on drowning, there's been a tremendous, I'm not sure explosion's right. I think we should talk about that as a splash or tsunami of research. It's certainly lots of momentum. It's a really good segue though to Olive. Olive, is this research being translated into action? And are we picking up all of the context of the context of local community action?
Thank you, Justin. And before I speak to that specifically, let me just say how delighted I was to listen to Florence and to hear her talk about things that are not, way up there, global resolution, but actually things that go directly to the fishermen that I see on a regular basis and what they need to do and what they are doing. And I think it's a very nice connection coming from the global, where we have UN resolutions, through country level down to where the action needs to be. But yeah, so are these big five, Caroline's big five, and the changes that in research that Colleen talks about, are they resulting in prevention, in actual interventions? I think, as she mentioned, they might have been sometime in coming, but I think we begin to see some activity in some of those countries where there was none. Of course, there have been countries where prevention has been happening for decades, for many years. And so I think we are talking here about those countries that are high burden for drowning, but have been very slow on the uptake in terms of prevention. And I think that we're beginning to see some movement there. So for instance, I'll use the example of Uganda. So we've maybe as recent as 5 years ago, we really couldn't say that there was much structured, systematic drowning prevention happening. And then we started to have the local data, which, thank you, Caroline, I think it's indeed a big milestone. And then it's been taken up by government, which I think we also need to acknowledge that when you come from the global platform, where you've been talking about resolutions that say we recommend these to countries, I think quite often we do not realize how difficult it is when we come to the country level for the countries to actually do those things that we expect them to do. And the resistance there has good reason. So for instance, when you say that drowning is a huge problem, and it indeed is, but these same countries that have high burdens of drowning also have high burdens of lots of other things, public health crisis. They have HIV, AIDS, malaria, tuberculosis. They have food insecurity. They have health systems that are fragile or actually completely dysfunctional. So when we talk about drowning as a priority, quite often these governments say, yeah, but we have lots of other priorities. So I think for a country like Uganda that has all of those things that I've mentioned, but that then appoints a ministry to be in charge of drowning prevention or a drowning strategy, that's big. So yes, I think that there's beginning, it's not just Uganda, it's happening in a few other countries, not many, not enough, but there's a beginning.
Okay, so I think there's lots of people that aspire to a local or a national action plan for drowning, a water safety plan, a drowning prevention plan. So you're hinting at big news next time we meet at a webinar for World Drowning Prevention Day. But can you give people just a little bit of a hint to the keys of success in getting a national government on the hook or interested in drowning prevention in a complex set of priorities as you've outlined?
I don't know about a hook, but I can mention a few things. So for instance, when you indeed have a government that has so many other priorities and so many sectors that are, it's so multifaceted, you might begin the way we did by saying, let's have an entity that can bring together these many different interests. So in Uganda's case, we actually started off with these efforts coming around local data that we now had, and we were saying, look, this is what we're finding. And the Office of the Prime Minister, which then acts as an umbrella and can indeed convene, different sectors, was in the first instance sort of taking the lead, but it quickly became evident that we were going to need one key government ministry or department that would then run with it. And that even when the rest of them would say, yes, we have a stake, unless you have that one ministry or that one department that becomes a champion, then you're going to struggle, it's going to stall, because ultimately it needs somebody in government that is going to speak for it, that's going to put it on their budget, that's going to put it on their work plan. And so I think finding that champion that is going to look at the data, be persuaded by it, and feel that it's their responsibility, their mandate. It's not an NGO. No, it's wonderful to have NGOs, and indeed they can be powerful. But I think we still do need to see that commitment from government.
Thanks, Olive. I think Carolyn has some expertise in this area, so we might go to you, Carolyn. But I think to paint a picture in Asia, and so much of our expertise and knowledge about child drowning prevention particularly emanates from studies in Asia. But, so the tremendous work from Merit Maker in Thailand is actually driven by a public health agenda. And in Vietnam, actually, it's social care and development takes that lead role. And I think in Uganda, it might actually be another ministry putting their hand up. So Carolyn, you, with the status reports across the region, what are your observations about this notion of multi-sectoral action? But actually the question that Olive's raising is, who is the government agency that's taking the lead or more likely to take the lead on drowning prevention?
Yeah, thanks so much, Justin. And Colleen and Olive, thanks for your comments, especially Olive around the process you've taken in Uganda to really finding a home or a lead agency for this issue of drowning prevention and establishing this multi-sectoral network who are engaged and passionate to act on it. And so with the status report project, we actually, it was a really excellent exercise to start a conversation with government representatives around drowning prevention. So it's about to collect the data for these reports. We did invite different individuals and representatives from various sectors in government together in one room to sit at a table and complete a questionnaire relevant to drowning prevention and water safety. And as we did this, slowly, each different representative at the table started to realize what their role was, what their mandate was, or their contribution could be towards drowning prevention. And this was a real light bulb moment for many people in the room, which was quite interesting. We'd start these meetings off, and maybe 70% of the people in the room weren't sure why they were there, weren't sure why drowning prevention was important, weren't sure what their role was. But after this discussion, after 2 or 3 hours reviewing these questions, people stepped away thinking, okay, well, hold on. Flood risks. Okay, I work in disaster risk reduction. We can do things to reduce flood risks in communities. This is a risk factor for drowning. And slowly, we sort of pieced together this puzzle of different sectors and stakeholders that need to collaborate and work together in a really coordinated fashion to address this central core issue of drowning prevention. But of course, Olive, as you very correctly mentioned, there needs to be a lead. There needs to be someone there that is a convener, that is the face for this, that puts their hand up and takes responsibility and says, yes, I'm accountable for this agenda, and I will lead this amongst my government colleagues. And in regards to your question, Justin, what sector should do this? There is no one response that's valid for all countries. It really depends on the individual country, how they're structured, where investment is, where capacity is. But it's very, very important to have these initial conversations, introducing all different sectors. And I have to say health really must be included in these initial conversations. That's really critical. Whether or not the health sector ends up being a lead agency really depends on that conversation. But it's really important groundwork to have. And again, having that leading agency is critical for progress.
Yeah, so we've gone from discussing global initiatives and global momentum, and now we've got lost in a big discussion about national momentum and local momentum. Colleen, just sort of some final comments from you on this, because I know that you were caught in the middle of the development of a Western Cape water safety plan, which is not national, it's not global, but it's actually provincial. So have you got some comments in response to Olive's ideas and Carolyn's more recent remarks?
I think, I can only really reiterate exactly what Olive has said. And I mean, we went through quite a very consultative process to develop a framework for drowning prevention and water safety for the Western Cape province, which is a province of South Africa. And we had great buy-in from all the stakeholders, and we developed this wonderful document that kind of had positioned it within all these different sectors. But getting buy-in to take that forward and implementing the recommendations has been really, really difficult. And at the moment, I think Jill Fortain is on this call as well. We have a very small group of 4 of us that are actually trying to position it and take it task by task to the right people. But really, for it to grow into a national thing, we really, really do need to find that champion and where we can position it. And I think the added complication, which all of you have spoken about, is that there are, particularly in the health sector here, we have these very many competing priorities. So you also need to find a champion that will take it, that has space in their budget. I think that's key as well.
Yeah, absolutely. We're having the same conversations in Melbourne yesterday about how you actually develop a local water safety agenda in a community. And so one of the challenges people are finding is in that situational analysis step and the consultation engagement, they're filling the room absolutely to the brim. And the majority of people in those rooms are wondering why they're there, to Olive's point. And it's really difficult to generate momentum from a room full of people that are all wondering why they're there in the first place. So, I think we really need to harness some of these experiences and case studies and start recognizing that there is no one answer here. There's no one expertise. There's a need to build some capability, and that capability, most importantly, is local capability. Listen, we could talk all night on this, I'm sure. Can I get someone in the chat? There's a really great podcast that the George Institute, that Dr. Jagnall did recently, and Olive was speaking in that, along with Danielle Obe from the Black Swimmers Association in the UK, and one of the ministerial leads from India. And it was a fascinating conversation. I'd encourage everyone, you don't have to be a researcher to get into that discussion and debate. Olive really gave some great little vignettes of her work. So a plug for that podcast. Listen, thank you very much, Colleen. Thanks, Carolyn. And thanks, Olive. Thank you very much. We're going to keep moving. There's so much to cover tonight or this morning. Thank you. Kind of feel like I'm truncating all of the discussions, cutting them way too short, but I'm sure we'll get a chance to revisit many of these discussions and meet many of these wonderful colleagues again very, very soon. We've got something really special. WHO made a call early on in the process, and they asked you to send your videos of your achievements over the last 12 months. So we're going to sit back and reflect on this video. They would like to acknowledge that there were many high quality submissions, including submissions from Colombia and Guatemala, India, United States and Canada that didn't quite make this video, but hopefully you see a little bit of yourselves in the presentation. So sit back and enjoy this video.
Every year, hundreds of thousands of lives are lost due to preventable drowning incidents. To address this issue in 2021, the first ever United Nations General Assembly resolution for drowning prevention was adopted. This resolution is aimed at increasing safety in, around and on the water to prevent drowning on a global scale. Since its adoption 1 year ago, the unprecedented UN resolution has spurred action worldwide. In Australia, nearly 500 registered swim schools participated in Swim Safer Week, hosted by Swim Australia. A campaign featuring heroes from a popular cartoon helped kids power up their swimming abilities. Lifesaving Victoria have released an updated drowning report to inform drowning prevention activities across the state. The Brazilian Lifesaving Society, Sobrasa, rolled out school-based water safety education programs, swim instructor training, as well as rescue and first aid classes for surfers and health professionals across all 28 Brazilian states. In collaboration with the Global Health Advocacy Incubator, the Vietnamese government provided training to approximately 1,400 swim and water safety instructors, enabling them to teach water safety skills to over 32,000 children and give lessons in survival swimming to 14,000 more. The grassroots organization, Hue Help, based in the Thừa Thiên Huế province, has worked with authorities, communities and families to provide training in swimming, safe rescue and water safety skills to 3,900 children. The National Association of Lifeguards of Costa Rica have continued their training and advocacy work on the importance of understanding risk when swimming and learning CPR. In Thailand, Phuket lifeguards have developed and implemented the Phuket Kids Water Safety Project, teaching children swimming, water safety and resuscitation skills. In 2021, Ireland established its first national water education safety programme for preschool children. Resource packs highlighting water safety dangers at home, on farms, on the beach and at other locations were designed by Water Safety Ireland and sent to every preschool in the country. The National Office for Civil Protection in Tunisia has established 205 guard points and distributed 1,165 lifeguard swimmers along the entire coastal strip to prevent drowning deaths on Tunisian beaches. Water Safety Scotland have conducted an interim review of Scotland's drowning prevention strategy. This review assessed progress made over the last few years and set goals for the future. As part of Etihad Rail's project work in Dubai, safety equipment has been purchased and training sessions have been performed with staff, demonstrating the importance of drowning prevention as a key component of occupational safety. Singapore Project Silent held public outreach initiatives on drowning prevention and water safety nationwide, promoting fundamental water safety ABCs. The George Institute for Global Health, together with the Child in Need Institute in India, convened a children's parliament across a number of communities in West Bengal to amplify children's requests for ensuring they can live, play and travel safely in their communities when close to water. The National Sea Rescue Institute of South Africa have provided nearly 7,000 survival swimming lessons, even in the most remote areas, through creating a mobile survival centre with a swimming pool inside. In Bangladesh, the Ministry of Women's and Children's Affairs has committed to establish 8,000 community daycare centres for use by 200,000 children aged under 5 years and provide survival swim teaching to 360,000 children aged 6 to 10 years old. The UK National Water Safety Forum has launched a new Respect the Water campaign, highlighting the risks associated with performing bystander rescue and encouraging contact with emergency rescue services when a drowning incident occurs. And in the USA, the United States Swim School Association created a customizable social media drowning prevention toolkit highlighting the importance of learning to swim. Additionally, the United States Life-Saving Association worked to raise awareness about rip current safety across the country. Inspiring progress has been made and the momentum is strong, but much work remains to be done. On World Drowning Prevention Day 2022, we call on everyone to do one thing. We call on governments to announce new drowning prevention policies, strategies and investments. We call on groups to share water safety information and launch public campaigns. We call on individuals to take water safety lessons and support local drowning prevention charities and groups. It only takes one thing to save a life. Join us. Do one thing today. Anyone can drown. No one should.
I'm sure you agree, what a fantastic video. So many great contributions from all across the globe. Our next panel focuses on that challenge. WHO challenged governments, groups and individuals to do one thing. And we're going to talk to 3 people about their one thing. So I'd like to introduce our first panelist, Esha Hussain. Esha Hussain is the partnership lead for Synergis Consulting Services in Dhaka, Bangladesh. She leads the national outreach and programming there. Prior to joining Synergis, Esha worked in communication knowledge management with UK Aid, US Aid and Save the Children. So fantastic background, including a master's degree in adult continuing and community education from the University of London. So welcome, Esha. We sort of let the cat out of the bag, but what's been happening in Bangladesh lately?
First, thank you. I'm so delighted to see that the project we worked on tops the milestone list. It's a surprise, actually. I didn't know. So, yeah. What was
the question is, I guess we did let it out very, very early, but I know this is massive. It's a big, big thing, and it was in the 5 list. But I think was like surely a big thing comes from lots of little things. So can you give us some insights about how that one thing came about and what you think were the important inputs to that decision of the Bangladeshi government?
Yeah, Justin. Again, Early this year, the government of Bangladesh invested $32 million project for scaling childcare centers and swim safe instruction as true proven drowning prevention solutions. But it didn't happen overnight, obviously. But if you ask me to isolate one thing, I would say the one important thing we did was we sought to understand the government pretty well. You know, what is important to government, how their project planning and approval procedure works, their priorities and limitations. So this advocacy process was not linear, and we were patient, flexible, agile, and most importantly, adaptive to changes and transitions in government. So as everyone else has said, you know, drowning was a low priority for government in Bangladesh also. And as there's no existing policy or legislation on drowning prevention. So what we did was we aligned drowning prevention with existing long-standing priorities for early childhood care and development, made linkages with ECD, early childhood development policies, government 5-year plans, and many of the SDG targets. So we shifted the frame to emphasize that drowning prevention in Bangladesh was an integral part of ECCD, since it's such a significant health risk for them. So why do we work on drowning prevention for children anyway? To prevent death so children may live rich and productive lives? Of course, government of Bangladesh wants this future for the country's next generation. So that became our unifying vision between partners and government, bringing everyone out of their sector silos. And it also enabled us to engage with a broad set of partners beyond drowning prevention, including the media. So we were able to amplify demand for investment and create policy awareness on wider impacts. So that's in brief my, take on the one thing you're asking for.
Thanks very much, Esha. So a unifying vision to bring partners around the table and understanding the government agenda. Absolutely fantastic. We'll come back to you in more discussions. Thank you. We're going to go to our second panelist who's going to talk about their one thing. I'd like to introduce Dr. Anna Katerina Goroga. She is a drowning prevention researcher at the Institute of Public Health at the University of Porto. She's the co-founder of IDRA, the International Drowning Researchers Alliance. She's also a member of the Medical and Drowning Prevention Commissions at the International Lifesaving Federation. Welcome, Katerina.
Hello.
Hello. Can you tell us your one thing?
Okay, so one thing at a time, I guess. So it is my pleasure to participate in this webinar and talk to you about, from my experience, how group interactions can be a catalyst for change. So I'm very fortunate, and as you mentioned, to have the opportunity to work in different groups, interacting with people from very diverse backgrounds and the large spectrum of drowning-related topics. So last year, I had the pleasure to see the output of a long journey, years of collaborative work that resulted in the publication of the first Drowning and Aquatic Injuries Dictionary, which I co-authored and coordinated. It is a document that assists in the use of consistent terminology and definitions, and ultimately impacting the way people collect and report drowning data. Also under my coordination and of Dr. Joost Beerens, the joint position statement about resuscitation of drowned person in the COVID-19 era was produced by the 3 largest umbrella organizations for rescue and life-saving in the world, ILS, IMRF, and IDRA. And it was published in a highly prestigious academic journal, elevating, as mentioned by Colleen, the drowning resuscitation in the medical agenda. So the first version of the document was produced in 2020, just before the beginning of the summer season in the Northern Hemisphere, in a time when little was still known about COVID and no vaccines were available. It is a guideline for organizations and individuals worldwide and was actually adopted by many life-saving organizations around the world. As a co-founder of the International Drowning Researchers Alliance, I have assisted in the hosting of a one-day event on the impact of climate change on drowning, a technical document and institutional declaration with the results of the discussions that took place early in June this year is being prepared as we speak and will be released soon. And as a member of the Drowning Prevention Commission, I have prepared a data collection tool to make a situational analysis of fatal and non-fatal drowning data collection in the world, as well as child drowning prevention interventions in place and the existence and progress being made to develop national water safety plans around the world. This survey will be launched later this week as a celebration of the World Drowning Prevention Day. Resulting from another group interaction, this time as a member of the ILS Medical Committee, I am working on a position statement regarding the mental health of drowning survivors as well as rescuers. And the aim of this position statement is to potentiate the engagement of this particular health sector, as well as the occupational health sector in the drowning prevention initiatives. And ultimately, as a result of these group interactions, I also had the privilege to be invited by the ILS African Region President, Dr. Mohamed Ali Harbal, to travel to Morocco and deliver a course on water safety for future child swimming instructors. So working at the group level is a great way to bring people together. Igniting collaborations that, of course, will potentially result in robust drowning prevention interventions. I know it seems a lot when you ask one thing, but the secret and the method I have been following is to accomplish all of this is doing one thing at a time. Thank you.
One thing at a time. Okay. Thank you very much, Katarina. That was very, very comprehensive. Thank you. Remembering that in the chat, if you like to put your hand up to get 30 seconds to say your one thing, it's coming up very, very shortly. So just log some interest there. Particularly, we're interested in people that come from a range of perspectives, including some voices from perhaps a lifeguards or practitioner level, organizational level. Sort of put your hand up and we'll try and get you into that chat. Next, we have Karen Conn. Karen co-founded the Zach Foundation in 2008 with her husband, Brian, after their 6-year-old son, Zachary Archer Conn, drowned when his arm became entrapped in a swimming pool drain. Zachary's memory is the inspiration for the Foundation's mission and activities. The Zach Foundation has funded free water safety and swimming camps for more than 20,000 children in at-risk communities worldwide. And they're spearheading the development of the National Drowning Prevention Plans in 4 US communities. So very, very topical. Welcome, Karen.
Hi, good morning, good afternoon, good evening. Thank you so much for having me here with you today.
Yeah, thanks very much for joining us. I know that that many people on this Zoom would have captured the attention at that introduction. And so I think that the logical place to start is for you to tell us about your son, Zachary.
Yes, thank you so much. So I lost my son, Zachary, when he was 6 years old, and he was actually a really good swimmer. And we thought that as parents, we did everything that we were supposed to do to protect our children around the water. Because he was a great swimmer and because he was closely supervised, with all of our children in the water, that we thought that we had protected our kids, but we actually had no idea about drain entrapments. And so unfortunately, after this, we felt like we had failed our children because Zachary had passed away, to something that we didn't know about, that it was important to us to try and prevent other families from having to endure the loss of a child. And as we started to do our research, we realized what the statistics were here in the US. And similar to around the world, drowning is the leading cause of unintentional death for children between the ages 1 and 4, and the second leading cause of unintentional death for children under the age of 14. And we felt that it was so important to make a difference, to try and protect another family from having to lose a child. And that really started our journey to drowning prevention here in the US.
What are some of the impacts that you've had in Zachary's name that you're most proud of?
So one of the things that you mentioned in my introduction, and that's the fact that we have reached over 20,000 children here in the US and their respective families through what we call our ZAC camps. And ZAC camps were really created because we thought that it was important to implement some, in-school curriculum initially. And we felt that that was going to be very difficult to try and implement right away. And so we looked at, who is drowning the most. And when we saw who was drowning the most, we realized that we could reach them through the Boys and Girls Clubs. And Boys and Girls Clubs are located throughout the world. And we created a program for children aged 5 to 9 years old. And we teach them water safety basics and drowning prevention. And then it's a week-long program. And we felt that that week-long program was not being impactful enough because we weren't teaching children how to swim. So we had the opportunity to partner with the American Red Cross and their Centennial program, which was launched in 2014 to also decrease drownings throughout the United States. And that has a learn to swim program, CPR training, water safety instructor training, and lifeguard and junior lifeguard training to try and reach middle school age children, which we also were not reaching through our ZAC camps. And so those, that is one of the things that we're really proud of. And in addition to that, we've had the opportunity to participate in the National Water Safety Action Plan. Prior to participating in that, we created our own local drowning prevention action plans in 4 different cities throughout the United States. And even through our ZAC camps, we're also proud to have reached, as I mentioned, over the 20,000 kids, but also in 24 states in 50 different cities throughout the US.
Fantastic. That's such an amazing contribution, inspiring. And there are many people in our audience that are equally passionate about swimming and water safety and taking water safety to particularly at-risk children. So the theme of this year's World Drowning Prevention Day is do one thing. Can you tell us about your son, Harry, and what his one thing?
Yes. So, so my son, his name is Henry. So he, after really prior to the pandemic happening, we were seeing this lifeguard shortage happening throughout the US. But of course, since lifeguard trainings have not been happening over the past 2 years, and really, water safety instructor training not happening, less and less people were having their swim lessons. I looked to my son Henry as he was thinking about a summer job last year, and I said, what would you think about becoming certified as a lifeguard? And especially given our family's loss, it was obviously wrapped around difficult emotions as well. And he was willing to take this on, and he ended up getting certified, and he's been working as a lifeguard last summer and again this summer.
Fantastic. It's an interesting story. There were like lifeguard shortages all over the world. So we wish Harry, not Henry. Sorry, Henry, not Harry. Sorry about that. We wish him all the best in his lifeguarding journey. There's certainly some great textbooks and advice from all sorts of people, in our webinar, that if he takes an interest in perhaps the more technical side of lifeguarding. Listen, thank you so much for joining us. There are so many people in the chat that are sending you lots of love and support and messages. And I do know that you're part of a wider group of families that are doing such amazing things in the US. And in Australia, we've also got some wonderful people that are turning tragedy into very real impacts at a community level. So thank you very much to you and your husband, And I hope you've enjoyed spending a little bit of time with the global drowning prevention community. We hope to see you again very soon.
Yes, thank you so much for including me in this. It's wonderful.
Thanks, Karen. Listen, we won't have time for a panel, unfortunately. The individual speakers did such a great job of talking to their one thing that we might have to keep moving so we can get to many more of you to come and join David and I in this discussion. So I'd like to move, if possible, just to give the moderator a little bit of time to get to the video montage. So we organised a video montage just of all the things that happened in the last 48 hours. It's hot off the press. It was created just a matter of minutes ago. And so sit back and enjoy this montage of your efforts on World Drowning Prevention Day 2022.
We are all going blue.
The instinct to jump in and help can be overwhelming. Fight your instincts. Make the right call.
Just one thing to help prevent drowning.
Well, hopefully you were uplifted by that wonderful video. Hopefully you saw a little bit of yourselves and your activities. I'd like to thank Monique Sharp from my office at the Royal Lifesaving Society Australia, and Justin from Buzz Films, and Caroline from WHO, who worked throughout the night and into today to put that video together. Fantastic compilation of some really wonderful things. Okay, so we're moving to the closing session, and we did put out the challenge. I'm not sure whether we're going to invite David back now or David back in a little while, but we do want to have a few more questions, and we're going to bring some people in, around about 20 participants, one at a time. They're going to get about 30 seconds, and we're going to have to cut you off at 30 seconds, I'm sorry. So this is sort of a super pitch, 30 seconds to say something really fabulous about your one thing for drowning prevention this year. So I'm flying blind. I'm not sure exactly who's going to appear But I'd say what I suggest you do is appear, say your name and go for it. And we'll stop you at 30 seconds and move to the next person.
Thanks so much. Justin, maybe we could start off with Ross McLeod. Ross, would you like to switch on your camera and your microphone?
I should be here, Caroline. Can you see me?
Perfect. Thank you.
Hello, everyone. My name is Ross McLeod from the RNLI and representing the UK National Water Safety Forum. Our Do One Thing was to launch a brand new water safety campaign on the 25th called Respect the Water, which had huge success with lots of pickup across our network, social media, events, lots of people going blue. And our challenge to the network is around how we've broken the echo chamber of people that are passionate about water safety and got our message out into the real world. So we need to build on this momentum for next year and really leverage that to do more brilliant things in the world of water safety and drowning prevention. I'm done.
Thank you, Ross. Very succinct.
Who have we got next, Caroline?
Okay, next up we have Dr.
Feels
Amy
inappropriate.
Eden.
Should we do this?
Yeah, absolutely.
Okay.
I think that was me, was it, Caroline?
It was Amy.
Hello. Oh, I'm feeling the pressure. Hi, everyone. My one thing is about drowning data. People who know me probably wouldn't be that surprised. I think it's really important that we encourage quality and timely data collection, including through non-traditional means such as media. And we'll have some guidance coming out from the International Lifesaving Federation about that soon. But the other thing is it's really important that we, I guess, expand our estimates of drowning to include transportation and disaster-related drowning like we've talked about tonight. Thank you.
Ooh, wow, extra time. Well done, Amy Peden. Next.
Next up, we have Dr. David Spielman. Dr. Spielman.
This will never go 30 seconds.
Hey, hello to all. I just want to say that I'm very inspired for you guys, and I thank you, and I bring it someone to thank you too. This is Tata, the first lifeguard to educate children, and that's what I came from. That's it. Thank you, Justin. Thank you all for your what you are doing for us.
Thank you, David. And you've got extra time. Okay, next, Caroline. That was great.
Thank you. Moving on to Alyssa Magram. Alyssa, I see you on my screen.
Hi, good morning and good afternoon, good evening, wherever you are. Wow, that little time thing is very difficult. I personally, the one thing I did is I swam 13 miles during the week leading up to World Drowning Prevention Day, and we engaged swimmers and paddlers in our networks here at Collins Hope to raise awareness and funds and get on social media, talk about what they're doing, talk about drowning as a global epidemic in an very active way. So we did that. We also promoted the efforts of Collins Hope and the resources we have. So I did a lot of swimming.
Fantastic. Thank you.
Perfect. So next up, Justin, if you've got the timer ready, so there's a lot of pressure on you as well, Justin. We have Sean Slevin. Sean, I can also see you up on my screen. Welcome, Sean.
Hi, good morning, and just thanks to all of you across the globe for your wonderful work in preventing drowning. We just need to come together to do more and more of this. It's so preventable. And for us at Swim Strong, we're really trying to change people's perspective and get it out of the recreational point of view into a life point of view. Our world is becoming ever so much more watery, and all of us, swim skilled or not, need to understand and live our lives differently in that regard.
Well done, thank you. Caroline, next.
That's excellent. We've actually got through the speakers that we have with their hands raised right now. If anyone else would like to speak, do please throw your hand up in the chat and I will put you to panelists. But it looks as though we might have, okay. Kirsty Doig. Are you with us, Kirsty?
Quite yet.
I didn't realize I was still on mute. Hello, I am Kirsty Doig. I am here from the Western Cape of South Africa from the Darcy Sunshine Foundation. And as another mother of a child lost to drowning, I just wanted to say that the work that parents of lost children are doing across the world is absolutely incredible and inspiring. And a thank you to the global community for all their work they're doing to prevent this from happening to other families and other parents. We are partnering swim schools with preschools to make sure that children are being educated in practical swim safety skills across South Africa. And we hope to just continue to collaborate with lots of other communities to reach as many children as we can. So thank you to all of you for all the work you're doing. Thank you.
Thank you.
Excellent. And I also have Purushottam Sharma as well here with us today. Purushottam, would you like to turn on your microphone and your camera?
It's good to see you, Purush, very soon. Here he is.
Okay, this is Purush from India. Good evening, everybody. The one thing that we were supposed to do on the 25th of July, we elected or selected CPR. It's right across the board, whether it's in a pool, on the beach, fisheries, no matter where. The moment you pick up a guy from the water, the first thing that you wish to do is to give him CPR. So on that day, we addressed live as well as online at least 3,000 people across the country who learned CPR. In fact, CPR is very, very important for us, and we've been doing that online, particularly during the pandemic, and we addressed thousands of people. And I would say that among the many countries who know CPR, we would be one of them who know what to do in case you recover a person from water. Thank you.
Thank you very much, Admiral Sharma.
Thank you. And perhaps we'll have two final interventions for today's session. The next person I have here is Kirill Kolev. Kirill, would you like to unmute and turn your video on?
Всем привет. Давно мы с вами не виделись. Прошло 2 года с момента коронавируса, и мы в России уже в первое время в этом году работать по пляжу, и спасатели у нас начали работать. Я на русском языке. Я думаю, вы перейдете на английский. Всем хорошего настроения и продуктивной работы.
Excellent. Thank you so much. Thank you very much for your intervention. And we'll make sure to get a translation with the slides, and we do send out this later. So thank you very much, Kirill. It's great to see you again. And very finally, last but definitely not least, if I can find on my, we do have Dr. Monwar Hossain. Dr. Monwar, please take the floor.
Thank you very much. Thank you very much. Good morning from New York. I am representing Bangladesh Permanent Mission to New York. I'm actually very, very pleased to see and overwhelmed that so many people are interested in drowning prevention and have been working for a long time. I personally am very pleased as a medical doctor to provide a small contribution to the first ever UN resolution to the United Nations. I'm grateful to all partners, including WHO, UNICEF, RNLI, and so many researchers and academics around the world, and also all stakeholders around the world. I'm grateful to them, and we would together will continue to take this initiative to move forward this initiative to save all the children in the world who we can save from drowning. And I must admit here that even with all medical advancement and technologies, we cannot bring down the child mortality rate to 0 unless we prevent this unacceptable drowning death of children around the world. Thank you very much again, WHO, for organizing this event, and I look forward to working with you in the future. Thank you very much.
Thank you very much, sir. That was a lovely surprise. Very, very nice way to finish our open mic session, actually. So lots of inspiring words from many, many, many great colleagues from across the globe. So it's my pleasure in closing the webinar to introduce one final set of words from Dr. David Meddings. I've certainly enjoyed spending the last hour and a half with you, and I hope that you've enjoyed some of the wonderful speakers that we've had this evening. There's been so many wonderful and common themes. There was someone in the chat that wanted to WHO to issue them with a PhD as a consequence of sitting in the webinar. I think there's plenty of ideas for a couple of PhDs. I'm not sure we'll be awarding a PhD anytime soon. But thank you very much for the opportunity of spending time with you all. Many great friends in the audience and many new friends, and I appreciate you attending the webinar. So over to you, David. Thank you very much.
Well, yeah, thanks, Justin. And, really, it's hard to do justice to the breadth of what we've seen and heard here today. I think it's been made clear from many different perspectives that our field is growing. It's gaining momentum. It's attracting a higher level of political engagement and interest. It's articulating a coherent set of messages and embracing safe and effective implementation of evidence-based practices. And all of that is fantastic news and cause for celebration. So really, there's nothing more important for me to do at this point other than to thank all of you who are contributing to this change. So thanks to the governments that are addressing the issue and who supported the UN resolution. Thank you very much, Dr. Monwar, for your being here as well. We heard here in Geneva on the 25th of July that there is an intention on the part of a number of governments to call for a World Health Assembly resolution for 2023. Thank you to the donors and philanthropic organizations supporting drowning prevention. And allow me to single out Bloomberg Philanthropies, who were the first donor to step into the global drowning prevention space in a significant way, and the RNLI, who are also supporting global drowning prevention efforts, both through their own programming and in tight association with WHO. And thank you, of course, to all of you, too many of you to single out, for your tireless work across the multitude and breadth of drowning prevention programs that you are running. And finally, I really need to thank the World Drowning Prevention Day Working Group that for a second year running has helped me to plan how WHO should shape the World Drowning Prevention Day and how it is celebrated. So thanks to Huyn Don in Vietnam, Frederick Oporia in Uganda, Justin Scarr in Australia, Gemma May and Kate Eardley in the UK, Roger Sweeney in Ireland, and my colleagues here at WHO headquarters, Jin Ni and the formidable Caroline Lukasik, who joined me recently at headquarters and has quickly proven to me just how indispensable it is to have a young, enthusiastic, and thoroughly competent colleague at my side. And so with those thanks, I draw this webinar to a close. All of you have a good day, and we look forward to the next year and seeing how much more progress we can collectively achieve by World Drowning Prevention Day 2023. Bye-bye.
Well done, David. Congratulations.